sinusitis. Have you ever wondered why we have holes in our skull? Holes? Yes. So, sinuses are basically holes in our skull in order to make it light. Because as we stood up, we used to be on our forelimbs, and as we came on our toes, we wanted this whole skull to be a lot lighter so that our neck and our spinal cord can support it. And so, evolutionarily, a lot of the bone was pneumatized, so air was filled in the bone to make it light. And what did that give us? It gave us our beautiful resonant voices. Without these sinuses, we would have a very nasal voice. We would say, green bananas. So, sinuses are a gift, and everybody has sinuses. What happens sometimes is these sinuses drain into the nose, and the hole that's draining into the nose, the ostium, gets blocked, and so the sinuses are filled with mucus. They have a lot of inflammation going on, and they can get infected. That's what we call sinusitis. Add itis in front of anything, and that's an inflammation. Conjunctivitis, inflammation of the conjunctiva in the eye. Arthritis, inflammation of the joints. So, sinusitis, inflammation of the sinus. What do you feel when you have sinusitis? You can have headaches, especially in the frontal and the maxillary area, just above your eyes and next to your nose. You can have a feeling of heaviness, congestion in your nose. You can have foul smelling odor from the mouth. You can have abnormal sense of taste. Usually, this is after a viral infection. If the viral infection doesn't get better in like 7 to 10 days, it has likely progressed to a sinusitis. It can also happen if you have polyps in your nose, if you have a deviated nasal septum, if you have allergies, if you smoke tobacco, or sometimes if you have immune deficiencies like B cell disorders, or sometimes if you have diseases like cystic fibrosis, you're more likely to have sinusitis. What can we do for sinusitis? So, for the most part, if you have a normal anatomy and if you have a normal immune system, your sinusitis is because of a viral infection. And that is because you probably got a viral upper respiratory tract infection with congestion, coughing, sneezing, runny nose, a little bit of fever here and there that should have gotten better in 5 to 7 days but did not. And it's like day 11 and you're still like congested. So that viral infection just spread to your sinuses, it blocked off the wall, and now you're having sinusitis. Viral infection usually gets better on its own with as your immunity acts upon it. What you can do to make it better is steam inhalation. Other things that can cause it are bacterial inflammation. How do you know if there is a bacterial infection that needs to be treated with antibiotics? So if the viral infection doesn't get better beyond the 10-day mark, it's time to get the antibiotics. If the viral infection gets really bad, so you have fevers of over 101.3 for more than 4 days, or if you have purulent pus-filled discharge from the nose, greenish, brownish, yellowish, then that's an indication of a viral infection, bacterial infections. Sometimes what also happens is the viral infection happens, it gets better, but then it suddenly gets worse. And that is also an indication of a bacterial infection. Usually, sinusitis is treated with antibiotics for at least 7 to 10 days, and it resolves after that. If it doesn't resolve in 3 months, then it's called chronic sinusitis. Chronic sinusitis has different triggers than acute sinusitis. It's usually due to an anatomic defect, usually deviated nasal septum, nasal polyps, or allergies, chronic allergies, or immune deficiencies. Chronic sinusitis is treated in a different way. If there's a persistence of infection that's causing the chronic sinusitis, usually you give a longer course of antibiotics and it gets better. If it's the allergies, then you management of the allergies is very important. And we've discussed that in our allergic rhinitis video. And if it's anatomic, then visit your ENT. You might need a surgery for your deviated nasal septum or for your nasal polyps. Or sometimes, if it's an immune deficiency, you might need a workup. So come to an immunologist and we can work you up. If you have any more questions about sinusitis, what you can do to help with your sinusitis, if you're getting sinusitis often, is breathing exercises. So breathing long deep breaths just helps movement of the air like in your nose and your sinuses, and that can improve the circulation. The other thing you can do is what is called neti. So neti is basically gel neti. This is a classic neti pot. There are also plastic ones that you can get from the pharmacy, and if through that you put water from one nostril and then it comes out from the other. It's a very effective technique in clearing up your sinuses. You should not do it when you have acute sinusitis, but this is a good thing to do if you have chronic sinusitis or if you have a tendency to get sinusitis. Steam inhalation is also a very good technique that can help with sinusitis. Um, if you have more questions about sinusitis, please feel free to type it in the comment section. And I hope you enjoy this video.